Try another attempt at high definition. The last one was so low definition it looked like broadcast TV gone bad. So this may be 720p, could be 1080i, could be 4XGLD, I don't know, but hopefully it's going to be okay. Anyways, let's talk about what happened. The video I shot yesterday, or a couple days ago, I got a little cut off because of the tape. So I'm going to make this, actually it's good as a separate video. We're going to talk a little bit further about what we talked about the other day, which was the comparison of fat grafting or fat transplant to hair transplant, and using the hair transplant model to understand a fat transplant better. We're going to focus on a couple thoughts that I think are really interesting. One is the fact that when you transplant someone with fat, over the time of about 9 months to a year and a half to 2 years, there can be something called a stem cell change. And I've lectured on this recently in St. Louis, where I had an African-American woman I did as a charity case who was involved in a motor vehicle accident, who had a very deep scar here that had undergone multiple scar revisions with really not much success. And about a year later, the scar healed about 80% just by putting a little fat under there. Now, is that a consistent promise? No, I want to be really careful not to propose this as some kind of guarantee that you're going to definitely get this improvement in your texture, tone, and all those things. But I think it's a really intriguing idea that somehow fat under scars or under wrinkles or under areas that are problem areas of the skin, after about a year to 2 years, actually begin to heal and improve. Now, part of the reason it looks better is because when there's more convexity to a certain area, there's going to be more light that hits that area, and your skin is automatically going to look better just for that reason alone. If I can cover bone and soften transition areas, that alone is going to make your skin look better. But the actual textural change to the skin, I have seen on a consistent level, but I want to be careful with what I promise you. But I've seen that probably about a year or year and a half out after a procedure. In fact, there was an interesting story. I was talking to Stephanie, who was filming this a couple days ago, and I thought it was just really interesting. I had a Vietnamese lady that I spent about 2 years trying to manage brown spots on her skin with laser, KTP laser, with bleaching creams, and nothing really seemed to work. And somewhere about 10, 11 months after I did this, she went back to visit her family in California, and the only thing the family remarked on was not my beautiful work, surprisingly, but was the idea that somehow her brown spots had faded. Now, obviously that's a very inconsistent finding, but it was just a very interesting idea that I struggled with these areas and couldn't get them right, but somehow about 9 months to a year later, the fat grafting alone had really improved that, improved that area. I had a 55-year-old Korean woman that had come through that wanted some acne scars corrected, and actually they were quite minimal in nature, and she really needed rejuvenation, so I did a fat transfer for her, and somewhere about 9 months out, her scars were about halfway improved. She thought it was because of the way she applied makeup. When I said, let's take the makeup off, let's take a look. And actually it was significantly improved with or without makeup in the same consistent lighting situation. And that stimulated a gentleman that came from Australia last week for me to do fat transfer that had some scarring. And I don't like to just have someone, especially travel 20 hours for me just to do a transplant into acne scars when I don't know if that's going to be 100% a guarantee, if you will. But what was nice about it is I was able to improve the hollowness in areas that were sucked in from scarring, and then hopefully by feathering out all the areas with scarring, I was able to give him some long-term improvements with the scarring. So now, we talked about that as being something unique to fat grafting. Actually, what's so amazing is to put it back into context. This is very often the case with hair restoration, and this is something that I really only learned about in September when I was in Montreal at the International Society of Hair Restoration Surgery, or ISHRS for short. What was interesting is there's areas called scarring alopecia, or hair loss due to a scarring condition, and the fear is when you transplant into this area, the grafts won't have enough blood supply to grow. We're talking about hair grafts. But what's really interesting is that a lot of people that start with a few test spots, they go in and put a few test sites, and they come back 6 months to a year to take a look at it. Not only the grafts growing well, but the area surrounding it, that white, dense, fibrotic, sick-looking scar is healed. And so somehow the grafts have an impact on that area that to me is really, really interesting. So there's some kind of relationship of the donor graft to the recipient site that actually interacts really, really well and starts to create healing. Is it stem cell? I don't know exactly what it is. Some people believe that the fat cells have some kind of estrogen-rich component that lets skin heal. Some people believe that because the hair graft has a sebaceous gland or oil gland in there, which is a unit of re-epithelialization or regeneration of skin, that's why the healing is there. But whatever the reason is, we're not certain about it, but it's a really interesting idea that can occur. So again, taking a step back and being careful to offer this as a bald guarantee. I'm not doing that. I'm just offering you interesting ideas that I've observed clinically. To finish up this video, I also want to address one component that's unique to hair that I don't know exactly how to relate to fat, but it's just taking that idea of donor dominance, or the fact that the donor supply affecting the recipient sites. There's actually been the converse, which is true with hair transplants, which is the idea that the recipient site, or the area that you've transplanted into, affects what was transplanted there. So what is an example of that? Two examples come to mind. When you transplant hairs into the eyebrows hair tends to grow very fast the eyebrow hair tends to grow slowly, but when you transplant hairs on your scalp here, they can grow very, very fast, as if they're acting like the donor hair. But what has been observed in some of the Korean studies is after about 1.5 to 2 years, the hairs actually begin to slow down and start becoming fine and start to act like the recipient site, like the native eyebrow hairs that aren't even there. Even if you had no eyebrows here, they can start responding that way. Again, that's not a guarantee, but an interesting observation. The other thing very interesting is something called body hair, occipital donor hair, that's moved into the recipient area. All you've got left is donor hair. Now, I'm Asian. I have no donor hair, so I'm pretty stuck. But for someone that's hairier, you can take the hair, transplant it into the surrounding scalp hair. And what's really intriguing to me is that oftentimes about a year or so down the road, I've seen this through some photographs, is that the hair actually begins to grow faster. We just talked about growing more slowly here, but because the body hair doesn't grow fast, but when you move it into the scalp hair, it actually starts to grow more quickly and start not to look like, I hate to say pubic hair, but finer hair that is more natural on the scalp. Again, no guarantees for any of these things, just really interesting thoughts of a relationship between donor and recipient sites that almost in every case is quite favorable. And to me, that's really interesting. So hopefully that short video gave you an idea about donor-recipient interplay and some stem cell changes that can occur.